Hello class, my name is Lauren Schrader and today I am going to talk to you about depression in children and teenagers. So before I get started on telling you what depression is or how to define depression, I want to state that there are several different types of depression. There's major depression, psychotic depression, postpartum depression, seasonal affective disorder, and bipolar disorder. Now, these are not all the types of depression, but these are ones that I'm going to talk about today, and these are ones that are most likely going to affect children and teenagers as well as adults. So, depression. Depression is not simply a bad mood or occasional sadness, because these feelings can be quite normal in children and especially teenagers. But in a depressive state, the mood lingers for quite some time and it can limit a child's ability to function normally. And so this is major depression. This is the first type of depression that I am going to talk about. So, major depression is a serious condition that is usually evident by a persistent sad mood, feelings of worthlessness or guilt, and finding it difficult to experience pleasure or happiness, especially in things that you used to. Now, major depression will usually interfere with daily functioning such as eating, working, or going to school, and sleeping. And a child with major depression may feel depressed almost every day, if not every day, and it may appear as them being in a bad mood or being irritable for an extended period of time. Dysthymia, I did not mention this one earlier, but this is another type of depression that may affect children. This is more mild as compared to major depression. So this will be evident if sadness or irritability may be mild and it continues for a year or more. Child will feel low, have low self-esteem, may have problems eating and feelings of hopelessness. However, unlike major depression, it usually doesn't interfere with their daily functioning, such as working or sleeping, things like that. So, another type of depression, I'm just going to briefly discuss this, is psychotic depression. Psychotic depression occurs when a person or child has major depression as well as some type of psychosis, so they may have some delusions or hallucinations. So this one is a little bit more rare, but it is something that still may happen. Okay, sorry about that little interruption. So psychotic depression will occur with major depression, as I said, and will co-occur with some type of psychosis, such as delusions or hallucinations. So really, it's going to be a little more rare when it comes to children in the classroom. But if you can see that a child is not in their right mind or may need to see a school counselor, then this probably would be a good time to contact them. So postpartum depression is another type of depression. Again, another one I'm not going to really get into because it's not going to really be as evident with especially not children, but maybe if you're working with some teenagers, they may end up being pregnant and have a child. So postpartum depression may be experienced by women after they give birth, and it's more severe than your typical baby blues due to hormones and physical changes in a woman after they have a baby, and just the responsibility of taking care of a newborn can become overwhelming, and it can lead to depression. Seasonal affective disorder is another type of depression that may affect your students. This usually occurs at the beginning of the winter months when there's less sunlight and people are spending less time outside. And it will usually lift in the spring and summer months, and it may return the following year once winter months approach again, or it may completely go away on its own. Another type of depression that can occur in young children and teens is bipolar disorder. Bipolar disorder is characterized by changes in mood from high energy to low energy and sadness, and such low feelings such as sadness and hopelessness, all the way up to irritability and bad temper. So, actually, as many as 1 to 2% of children could be affected by bipolar disorder, and it typically develops in later teen years and early adulthood. And there are some different types of behavior to watch for in children, such as giddiness, silliness, rushed speech, irritability, or a heightened sense of self-power or importance. And it's also important to note that with bipolar disorder, children may participate in risk-taking behaviors such as experimenting with drugs and alcohol, and as well as some sexual behaviors. So when it comes to diagnosing depression, a doctor, it will begin with a visit to your primary or regular doctor, and the doctor may begin by ruling out the patient other things in the patient that may cause some of the same symptoms of depression, such as a virus or thyroid disorders, and sometimes even some medications may mimic the same symptoms. A doctor will perform a variety of tests, such as a physical examination, lab tests such as blood work, things like that, and interviews with the patient to rule out those possibilities. And if they're not able to find any physical conditions that might cause the symptoms, they may refer the patient to have a psychological evaluation. Now, a psychological evaluation will be performed by a mental health professional, and they will begin by evaluating the patient and discussing whether there's a family history of depression or mental disorders, and patients may be asked to explain when their symptoms started, how long they have lasted, as well as the severity of the symptoms. So there are several different types of symptoms when it comes to depression, and according to Kids Health, to meet the criteria for diagnosis, a person needs to have 5 or more of the following symptoms present for more than 2 weeks. So a feeling of being down, a lack of energy, inability to enjoy simple things that used to bring them pleasure, lack of desire to be with friends or family, feelings of irritability, inability to concentrate, changes in weight, significant change in sleeping habits, feelings of guilt or worthlessness, aches and pains, lack of caring about what happens in their future, and some frequent thoughts about death or suicide. Now, once again, they do not have to have all of these symptoms, but at least 5 of them present for 2 weeks or more in order to be diagnosed with depression. So when children and teens are suffering from depression, they may have a loss or gain of weight, sleep too much or too little. In your classroom, they may have trouble concentrating, thinking, or making decisions, thoughts of death or suicide again, and they may participate in risk-taking behaviors, pretend to be sick or refuse to go to school, cling to a parent, may sulk, get into trouble at school, be negative and irritable, withdrawn, loss of interest in friends or activities. So a lot of the symptoms that I had mentioned on the previous page are some to watch for. Okay. So, when children are in school, there's a possibility that they see their teachers more often than they do their parents, and so it's very important as teachers to be watching for those symptoms. And as a general education teacher, it is very important to communicate with special education teacher and vice versa. And so as a special education teacher, it's very important to let the general education teacher know that children with learning disabilities are more likely to be depressed than other students. It can be difficult to sometimes recognize symptoms as They may be an internalized behavior, so they may experience the behavior and I'm trying to think of the right way to say this. They may suffer in silence rather than cause a disruption in the classroom. So it is very important that students are provided with unconditional support from all of their teachers and that all the teachers work to help create an inviting classroom where children can feel safe. So it is very important to help them feel that they can participate without fear of ridicule or rejection, and due to the fact that children are more likely to avoid school if they feel insecure. And so now I'm going to discuss some strategies to show support for students, such as showing them unconditional acceptance and being a good listener, keeping an overall positive tone in the classroom, and it's very important to avoid singling out students with depression and help them to develop routines that will increase the effectiveness of learning. And teachers especially need to make it known to students that they're always going to be there for them and they can count on them for help and understanding. Alright, as a special education teacher, one of the things to make known to the general education teacher is that students with depression may need help keeping their things organized. There are several ways to help them stay organized, such as a daily planner to keep track of their assignments, help them keep their learning space organized. You can even turn that into a fun activity for all the students in the classroom, or as like an exit ticket before they're able to go to lunch or recess. And they may also need help organizing their assignments, especially with essays and large projects, so use things such as graphic organizers, timelines, or other guidelines. And incorporating some physical activities in the classroom may help as well, because this can help them to alleviate some of those symptoms of depression and gain some energy and help them remain organized. So some accommodations that can be used in the classroom for students with depression is that they may need to be allowed to work in a quiet place. They may need help. Due to their having trouble concentrating at times, they may need a special place where they can go and work, and extending time allowed for an assignment or a test. Important to increase wait time so they do not feel stressed or rushed when you ask them a question. Check their assignments regularly to be completed, and it's also very important to use a variety of assessments so that students can show a variety of their abilities, and that's very important with all students, not only with students with depression. So since concentration and focus and memory are things that students with depression may struggle with more than other students, they may need some specific accommodations. So some other things that could be suggested are providing hard copies of notes for students, an extra set of books for them to have to remain at home, reducing the amount of homework, and providing extended time again, and possibly word banks to help them recall information. And there may be times where students feel they cannot cope in the classroom, so they may need to provide you with a signal that they need to go to a pre-designated place, such as the library, where they need to go and cope and settle down and collect themselves. So anti-bullying, this is something I think is very important to bring into the classroom. Bullying is a major factor to teenage depression, and prevention is really key when it comes to bullying. And there's a significant relationship between bullying and teen suicide, especially with students with special needs. And bullying is not one of the only factors of depression. There's also biological and genetic factors, and chemical imbalances in the brain may even cause some depressions. So finding the reason can really help come to a solution, and it's very important to watch for significant life events or changes such as death of a family member or a move. So in summary, there's several different types of depression. It's important to watch for signs of depression and provide unconditional support for these students. as well as modifications and accommodations.